Aside from the really obvious catastrophic moments in our lives, it can be really difficult to figure out whether or not we need therapy. So let's try to figure that out together. Hi, I'm Kim Long, and I'm with Docha Psychological Services in Spruce Grove, Alberta. Okay, I need to admit to you, I have a bias. I think we can all benefit from therapy. We change the oil in our car, so in order to maintain it, so why don't we check in on our brains and do what we can to maintain them? But it doesn't really matter what my bias is. This is actually about you, so let's work together to figure out whether or not, or what criteria we can use to determine whether or not somebody needs therapy. So some key considerations. There's two kind of questions you can be asking right off the bat. First of all, have you been able to solve the problem on your own, whether it's in the past or currently? Secondly, has talking with other people helped, like in talking with friends or family? Has that helped at all? And if it has, then maybe you don't need therapy. But if the answer to those questions is no, then there's a further consideration that you can use, and that is actually something that we use as therapists with our DSM, which is our diagnostic manual. There's a phrase that is in with almost every diagnosis that we are considering, and it goes something like, it has to cause significant distress or impairment in the social, occupational, or other important areas of functioning. So basically that means it has to be messing up your life weekly or daily and keeping you from living the life that you want to live. So we kind of have to look at distress, but before we do, it's also important to point out that others can actually be more upset about the issue than you. So you might not actually think you have an issue, but let's say you are gardening in the summer at midnight and you are in your underwear singing My Way at the top of your lungs and you are just loving life. Well, that's great for you, but it could be causing some problems with your neighbors or with your family. They might have some concerns. And so as a result, it starts to impact your life socially as well as within the family context. Okay? So extreme example aside, you do need to consider what others are saying as well. So what is distress? To this, I turn to the American Psychological Association. They have some great resources that define what distress is. But one thing could be, are you ruminating about it? Are you thinking about it most of the time, either weekly or even daily, several times during the day? Do you also experience shame? Do you want to hide what's going on? Also, is your quality of life kind of going down the tubes? So, for example, it could be you are avoiding things, situations, people, or people are avoiding you. It could be that you start to feel sick more often, or you experience more pain or more fatigue. Our bodies often tell us that something's going on far earlier than our brains will. So those are three ways to consider what distress is, but I'm sure that there's more that you can think of. So basically, if your mind, body, and emotional state can't or is struggling to go back to normal or average for you, then that would be what would be considered distress. Okay? So if you're wondering about therapy or what the next steps would be, I really invite you to answer the questions from the video. So if you're wondering whether or not you do need therapy, ask yourself, have you been able to solve the problem on your own? Has talking with other people helped? And are you noticing significant impairment or distress in the social, occupational, or other areas of your life? So if you answer that and decide that you want to take it a step further and start looking for a therapist, there's a bunch of different ways you can do that. So you could start with a web search. The Psychologists Association of Alberta has a great referral system. So basically you go online, you enter where you're looking for in the province, what you believe your issue is, and then it spits out a bunch of names that you can then call. Okay, I'm sure other provinces or states has that feature as well. Another thing that you can do is ask your doctor. Sometimes they have some great referrals for you. And one of the best is actually asking your friends, because they tend to match you with somebody that suits you almost right away. So, with that said, hopefully that answers any burning question about this that you might have. If you have any questions or concerns, please feel free to email me. It's klong@dochespsych.com. And otherwise, just take care of yourself. We'll see you next time. Bye.